going to talk about managing the demented patient and talking about some of the current controversies and management of these particular entity. In terms of etiologies of dementia, there's multiple etiologies to cause cognitive dysfunction. Among them, Alzheimer's accounts for over 50% of the cases, but it's important to keep in mind that many cases of dementia are actually of a mixed variety. In other words, they may be due to both vascular etiologies as well as underlying Alzheimer's. Now, as dementia progresses in patients, oftentimes because of their behavioral disorders, these patients are prescribed a lot of neuropsychiatric drugs. And the current or conventional thinking is that many of these drugs have interactions with anesthetic agents such that they're more susceptible to the central nervous system depressant effects of anesthesia. However, despite this thinking, the truth of the matter is that there is no difference in terms of anesthetic requirements when comparing demented and non-demented patients. As we see here in terms of TIVA, the total intravenous anesthesia, the maintenance anesthetic requirements for both propofol as well as remifentanil are no different comparing demented to non-demented patients. Similarly, when we look at inhalational anesthetic requirements, once again, it is no different comparing demented and non-demented patients. So where do the differences in perioperative management occur in these types of patients? Well, for the most part, these differences occur in the postoperative period. For one, many studies, such as the one shown here, clearly show that patients who have underlying dementia receive far fewer opioids than patients who are cognitively intact. Now, it's unclear whether this results from the fact that patients with dementia are more pain tolerant, or it could also be because of the difficulty of assessing pain in these types of patients. But in any case, you need to keep this in mind in managing these patients with cognitive dysfunction. In addition, as stated in some of my previous lectures, patients with dementia, although by and large the complication rate is no different between cognitively intact and demented patients, the big difference is in that of postoperative delirium. And as we can see, this is a series taken from hip fracture patients where most of the complication rate between demented and non-demented patients is similar, except for that of postoperative delirium, where it's actually twice as high in the patients who suffer from dementia. Now, it's important to remember that dementia also comes along with it many associated comorbidities, and that's been recognized for quite a long period of time, in that dementia is actually associated with a greater mortality. Now, whether or not this translates to greater mortality in the immediate post-surgical time period has yet to be defined yet, but it's something that you need to keep in mind. Now, I wish to spend the remainder of this lecture talking about one particular question, that it's something that I get asked quite a great deal in my practice, and that's, does anesthesia actually cause postoperative cognitive decline? Now, this is a very, very hot topic right now, and so hot that not only is it discussed in medical fields, but it's also being discussed in the legal field.
He over-anesthetized her during a GYN procedure. Find out why the doctor over-anesthetizing this patient cost him hundreds of thousands.